Hey, Dr. Birchler here. This is a picture on the screen of a gal who I met for the first time last week. And you can see that there is some hardware inside the body here. In this case, she's had a lower back fusion a few years back. The bottom two vertebrae, this one and this one, fused to the tailbone below them. And a very significant portion of people with fusions of the spine, whether the back or the neck, in this case this is the lower back, they will end up getting similar pain, maybe not identical, but they end up getting back pain or leg pains or weakness down the road after the fusion. And the spine can't move anymore. And so you tend to have areas above or below the fusion starting to have increased movement or stress, and they start to misalign and certainly start to wear out faster and get degenerative discs, and then that just turns into now pain again, and it may be different than the reason they had the surgery in the past, but the end result is that they have already had a surgery to take care of things, and now they are having problems again. And where does that cycle end? You just go and fuse more things. Those situations will tend to be very, very poor outcomes to continue to add fusion upon fusion. So in this case here, what I wanted to point out is, in this case, actually the disc above the fusion is not too bad, but if you look right above that, there's a bone and a space that's called a disc, and then a bone, and there should be a nice thick space, every bit as thick or thicker than what you see here. You should see that there, but you can tell it's almost totally degenerated. It's worn down, and the vertebrae are actually touching. Scroll on this. The vertebrae are actually contacting here. There should be space between them. They shouldn't touch. So this disc is so bad that the vertebrae are actually in a bone-on-bone condition, and it's severe. It will never return. That being said, what do you do to help a person like this? Well, what I've learned over years of dealing with this stuff is if you change something, if you take a bone that's like that, it's bone on bone, and you move something even 1/4 of 1 millimeter, you move something just a little bit, and even just for part of the time, because it's continuously like that. If you just even move it a little bit, and even just move it temporarily, that person can start to get some pressure off and get some relief. To actually help a person with any significant outcome, that person will need to have some frequency of treatment, in this case chiropractic or some specialized types of traction, distraction, decompression of the spine. And that person will need to have that done periodically throughout their life to help them function better, because understand it will never be fixed. It will never be new again. In fact, the only thing that can happen with that is it can get worse. All you can do is attempt to arrest or maintain it and get pressure off, allowing things to improve, though they won't necessarily be fixed or new. And some people think that, well, why don't you just go once or a few times and doesn't it fix everything? Well, that's fantasy land. That's la la land. Things happen, things wear down, and people then have pain or dysfunction for the rest of their life. And so how do you help that person have the best life they can, understanding that things are not perfect? And it takes taking care of that person over a long period of time to give them the best outcome, the best quality of life, given the case they're in. In this case, prior spine surgery, and then the spine wearing out, above where that fusion is. Hope this helps.